Welcome to the Be Amazing podcast. On this show, we'll give you the fuel you need through motivational pep talks, the fitness tips to be your healthiest self, fortitude to push through the hardships, and focus you need to build the skills needed for the next level, no matter what that looks like to you. I'm your host, Cel Smart. I'm a wife, a mom, community leader, and fitness professional of over 18 years. I'm here to be your biggest cheerleader, advocate, and connector. Let's be amazing together. Hi, everyone. Welcome to the Be Amazing podcast. I am your host, Cel, and today I have a special friend with me today who is not just a friend, but she's been a mentor for me for years, and just a beautiful person inside and out. And her name is Dr. Kaney, and I am so excited that you're here to have a conversation with me today.
Hi, Cel. I'm so excited to be here.
There's so much that we have actually done together, which is how, just to kind of go back and how I met you through community, which was part of the Charlotte Chamber at the time, which is now Charlotte Regional Alliance. But they had a project called Healthy Charlotte, and you came in, and I remember the day you walked in, and I was like, that is somebody that I need as a mentor in my life.
Well, and we became immediate friends, if I recall correctly, and we did some
Yes.
amazing things together. So yeah, we had a ball. And there's so many of us that are still in touch with each other from, and that was what, 10 years ago, probably. So
Oh, yes.
yeah,
Yeah. So much there. But let's really go ahead and dive in, because I really want everyone to understand a little bit more about who you are, what you've actually done in the Charlotte community, and give us a little more like the personal side of you, like family, hobbies, like all that fun stuff.
sure. Sounds good. Love it.
So tell us a little bit about your history of what you did in healthcare here in Charlotte.
Yeah, it's funny actually. So I started in healthcare. Well, I guess 27 years ago, I moved to Charlotte. I'm from Buffalo, New York originally. And I actually got to do a really cool thing over the summer. So we go back and spend the summers in Buffalo. My whole family is back there. And when I was 12, I was actually in a really serious ATV accident, and they saved my life at Children's Hospital of Buffalo. And that's honestly how I got into healthcare. They saved my life. I had to have immediate surgery. They took out part of my liver. I also had my gallbladder removed. So I was in the ICU for quite a long time. And then after, I survived that, I actually started volunteering at that hospital. And then when I was in college getting my biology degree, thinking I was going to be a doctor, I actually started working at that hospital. So it's fabulous. I went to University at Buffalo for undergraduate and graduate. But this summer, when I was back, I got to go back and visit the PICU. And they weren't necessarily the nurses that took care of me, but they were there 30 years ago when they saved my life. And so that's how I got into healthcare. I think I've been adamant from an advocacy part for the patient and also for the frontline staff. And so I hope that's what I was able to do for most of my career in traditional healthcare. And now I really want to try to help us be healthier. So I got my degree in public health, and I'm trying to help us stay out of the emergency department and out of the hospital and see if we can live a healthier life together.
That's so cool. I didn't even realize that that was part of your story. Like, I don't think we've ever really talked about, like, I was always intrigued because the way that you went about, from what I saw with Healthy Charlotte, and just the passion that you have for public health and the work that you did here in Charlotte through Atrium. Like, I knew there was a passion there. I just didn't know like what, where it all came from. And that makes total sense. And then you had this amazing career. So you were, a C-suite executive for 25 years, like in those high level positions. What was that? Was that what you were out to do? Or did you feel like that was what was going to help you make impact and change?
I do think it ended up to be a real gift that I could make impact and change, because when you're in a position of authority, You have a lot of responsibility, and then you also are able to make a big impact. But I did have my job when I was very young. I was promoted to a vice president at 27, and I was running the emergency department at Carolinas Medical Center and the trauma center. And actually, they were two of the best and biggest departments in the country at the time. And let's make no mistake, I was not qualified for those jobs on paper, but I worked with the most amazing team, right? I mean, I think what I learned by having big jobs, and really, I think an administrative job, when you really don't know how to save anybody's life, your job is to really help the people who do and do make the impact for patients better. And that was just the way that we worked. It was always a great team, usually a physician, a nurse or a respiratory therapist, and then an administrative person or a paramedic or an EMT, somebody who was on the front lines, that we just developed plans together that we could make it better, and try to make a really, really hard job manageable. Those jobs are very difficult, and I hope I never took that for granted.
That's awesome. When when you got into that position, because you started it so young and you're, going up the ladder and you're really I'm sure at that point, and this is I'm just guessing at this, but you worked with a lot. It was a very male dominated part of the system at that time. Were you confident, were you an immediately confident, strong person when you started, or did that really help shape you and really give you a voice?
Yeah, you know what? I was raised, my parents are very strong, very confident. I'm one of three girls. And my mom is, she's great. My dad is great too. But my mom, this story I'll tell you, she was like, look, you are going to participate, right? You're going to be, I don't care what you do, but you're going to be in there, you're going to participate, and you're going to be able to be independent. So education was the way that she taught us to be and to use our voice. And then my father was always very committed to being in the community. So I think how I would reflect on your question is that I never looked at those positions as hierarchy or my gender or I always looked at them as like, okay, we got to help make this better, right? We got to help do the best we can do for the people that are counting on us. And so maybe I was naive. Maybe I just didn't care because it didn't matter that much to me. Some people have told me that I didn't care about title because I had one at such a young age, which could be, the case, but I think I try to focus on the work and the people. As you get older and, and healthcare has gotten a lot more like a business, which I'm not sure is always good. I think the politics sometimes dominate now. And I do think later in my career, I really had to own the fact that I was a female and one of the few females that were at the top of the organization, and what kind of responsibility came from that.
What so for because there's a lot of professional women that listen to this podcast, and some are pursuing different sides. So some are pursuing in business, corporate level positions, some are pursuing entrepreneurial. As far as like in the corporate world, if there is somebody young or somebody that's aspiring to do more, is there a piece of advice you would give someone that is, looking to go to the next level?
Yeah. I mean, I got great advice when I was younger that was like, do your job and do more, right? And that doesn't necessarily work more, right? So, I mean, obviously work-life balance is a big deal for people, but I do think you have to perform your job and then ask for more, right? Like make sure people know that you want to do more and you want to give more and are ready to do more. Lots of times women think they have to check every box before they ask for more. And I don't know, I wasn't really afraid of that. I just figured I would learn it or I would ask somebody to help me. And I had a lot of people that helped me. And that would be my second piece of advice is, you're going to run into people that are jerks to you. I had plenty of people, but I had plenty of people that weren't, and I didn't spend my time thinking about the people that didn't want to help me. I had a great group of people around me that did. So ask people to help you. Ask to go shadow people, ask to go attend meetings with folks. And if people tell you no, I know sometimes that, is not easy to hear, but just go find somebody who says yes. So get yourself in there and, you will find some people who want to help you. Even though sometimes it feels like maybe people don't, don't stop asking. You'll find the right person.
I have to say that's like one of the greatest pieces you could give, because I know for me, like I am not in the medical field. I am not even anywhere close to that. But I remember just the way that you led the team with Healthy Charlotte, the way you led the community effort and the passion and the drive. It was just like there was something about you that I knew for myself that I could gain from that. Like it didn't even matter that I wasn't even in the same, professional field, but there was just something that I gravitated towards you. And it was like we literally like for the I guess it's what 4 years of like walk and talks. Like I'll call you like once a quarter and be like, okay,
Yeah.
let's go walk and
Let's
talk.
go walk. Woo! And we're talking the whole time. I love it. I love it.
Yeah, so I love that because I have very much experienced that with you, and you have not only been a mentor for me, but you've become my friend through the process. So I 100% agree with that, and you totally back it up because you did that. With you could have said, "Seal, I do not have time for this." Like, there was too much going on, but you always made time for it, and so I think that is such a gift that I know I have received from your friendship and from mentorship. So yeah, I think that's a wonderful thing. And I agree with you. You don't, if you don't ask, you're going to miss out because
Yeah.
there are some really great people that have a heart to give, but you have to be willing to say, hey, can you help me? Or do you have a few minutes to talk, and not be afraid to do that.
Well, and I think women, again, I try to get help wherever I knew that I needed help, right? And I also tried to give help where I felt like I was qualified and could. But I do think that women helping other women is extremely powerful. We do think about things differently. We do approach things differently, even though you try to put up a strong front. There are times you get your feelings hurt that you're, trying. So to me, I participated in a lot of programs that have women as sponsors together. We have brought men into that because you can't really do things alone. We have to do it together. But I think women helping other women is so powerful. And we still have work to do there. We still have to. So I think anybody who's listening to this, and that's a reminder for us, is that let's just keep helping each other. The world is a better place when our voices are there and we're making the difference.
Absolutely. Collaborations and coming together and coming from different parts of, really, that's what makes community work. Like
Yeah.
that we all come from the different sides. And, talking about community, what was like the first thing as far as making an impact in the city of Charlotte? What was like one of the first things that you did community wise?
Yeah, that's a good question. So this is funny. So, my mom actually never went to college. And so her, gift to us of education, my father and I really was very close to her. So I'm from a big family. And so I remember when, my sisters and my cousins and I all made my mom like this honorary degree. Because what she did I'm one of 22 first cousins, a big Irish Catholic family. She would give us books, right? So everybody would get a book, right? So everybody would come for Christmas and everybody would get a book. And so my sister Amy and I are older than everybody's kind of 5 years younger than us, all the cousins. So my mom would give us books sometimes to read to make sure they were appropriate for the kids. So right before I left to come to Charlotte, my mom gave me this book to read. It was about this kid, I can't even remember if it was a boy or girl, that got in trouble. And part of their community service is that they actually had to go work at hospice, right? So they did some. So I read the book. I was like, yeah, that's great. You can give it to our cousins. But when I came down here, my very first thing I did was sign up to be trained to be a respite volunteer for hospice. And so now 27 years later, I've been doing it for 27 years. So I love it. I have a brand new patient that I started with a couple of weeks ago who's 101 years old. And it has been absolutely fabulous. And so that's my first community experience when I moved down here.
Wow. And you've been involved in so many other parts too. As far as like, is there a project that's been dear to your heart that you had the opportunity to, if you want to say jumpstart or create, or, at the beginning of, is there something that's close to your heart?
Yeah, I would say there's two things. And one, I'll get, when I moved down here, it was Carolina's healthcare system. And so Harry Nurkin, Michael Tarwater, I'll date myself with some. They were in charge of the organization at the time. And it was a very community-minded organization. So I was allowed to be involved in everything, and loved it, being part of that, being part of the team as a regular part of my job. But I would say there's probably two things, Seal, that I really look back on. And we, prior to this, just had a conversation. So when I was running the emergency department, I was called by Chief Mowry from CMPD, and he asked me to come to his office and talk to me about creating a program, which became the Forensic Medicine Board of Directors. And we started working with the Crime Lab, CMPD. Peter Gilchrist was the DA. We worked with people from Presbyterian at the time, Carolina's healthcare system, Queens, and we actually set up what was the first domestic violence program that was community wide, so that we could have standard intake for folks when they came to any of our emergency departments, and that we actually could collect the evidence to capture the bad guys, really, and close the loop on some of the things that were happening. So I was really, really proud to be part of that. It's been around now for, well, probably 25 years, probably helped over 3 million people. We were the first emergency departments in the country to do universal screening for domestic violence. And, little known fact, I talk about this in my book. Ray Caruth was actually the first person that we were able to catch. So when Sharika Adams came into the emergency department and we were not allowed, we were not able to save her life, one of the trauma doctors asked for her to write down who did it. And Peter Gilchrist would tell you that that was a critical piece of information that really led to Ray Caruth's arrest. So pretty powerful and directly impacting the community. So that's kind of cool. I think that program is still thriving and really collaborative. The second is I've been a hunger fighter my whole life. So Loaves and Fishes and Friendship Trays. So I've been involved in Loaves and Fishes for probably close to 20 years. And just before the pandemic, we started conversations to merge with Friendship Trays because, food insecurity is solvable. It's really a distribution issue. So we took two awesome organizations, and because of their leadership, I'll give a shout out to Lucy Bush Carter and Tina Postel, brought those organizations together. And through the pandemic, we were really able to help a lot more people because we had joined forces. So I think probably those two things are pretty meaningful. Not that it wasn't me. Everything's always a team, but I enjoyed both of those very, very much and look forward to them continuing to make an impact in the community.
Well, I think both of those are like just amazing, and it just shows like this has been your passion all along, and it goes far beyond the emergency room doors or the hospital doors. Like it's literally in our community creating things that can help people, and you're able to have witnessed that, changes that it's made. I've seen you speak when I went to Loaves and Fishes, and I don't remember, like, I can't remember the exact meeting I was there for, but it was just you were speaking at that point, and just to see you in action and see that like you're a woman of, yes, you're a woman of your word and action. Like you don't just talk, you do. Thank you so much to Novice Studios for sponsoring the Be Amazing podcast. You might have noticed Be Amazing has a new look, new titles, and a YouTube channel. Kristen Stegall and her team helped me put a new look and strategy in place to take Be Amazing to the next level. If you want to launch a podcast, revamp your existing podcast, or hand off your production to an experienced team, schedule a call with Kristen at novicestudiosclt.com or head to the link in our show notes. You retired from the hospital system after 25 years, and you have launched into a whole new chapter. We have to talk about this because you've written a book.
I did, and I'm a terrible writer. So how funny is that, right? When I got my doctorate, I can't even believe I was able to write my dissertation. But yes, I have written a book. And the secret is that I actually have wonderful chapter contributors, so I only had to write half of it. They wrote the second half.
But I think it's amazing because it's like, you shut one chapter, you open up the next chapter, and this chapter allows you to even do the same, like do more. I think like you're now like you've created several things. So this book is the Whole Person Index, both medicine and public health together. Explain to us a little bit about, what this book is about and kind of what you're doing with it to really inspire change in the community.
Yeah, sure. So, when I kind of picked my head up, you get through your career at a certain point, and I would encourage all of us to do this. We just talked about my community involvement. The reality is that I've been a volunteer for hospice for over 25 years. I've been a hunger fighter for over 25 years, and I love working with other people. That's kind of been a signature in how we get teams together. So, you get to a certain part of your age and you kind of ground yourself in what makes you you and what brings you joy and where you think you can add value. When I was going through the later parts of my career in the healthcare system, and it was an honor to serve through the pandemic, it really was pretty clear to me that the disparities we had were not being solved. Nobody was really solving it. Big healthcare wasn't, and big public health wasn't. I happened to be trained in both, which was unique. I didn't really realize that. So 25 years of healthcare experience, and I also have my doctorate in public health from Chapel Hill, which is one of the best schools in the country. So the book is about that. Really, when you look at discipline, when you look at training, when you look at expertise, if we would actually intentionally put the practice of medicine and the practice of public health joined together systemically, we would be able to really radically change the health outcomes of the United States. And that's what the book is about.
Well, and when you're talking about public health, like I think medicine is pretty, like, I think we all understand what that, we say medicine, hospital, ER, like all of that, doctors, physicians, all of that. But when you talk about public health, what does that involve? What does that mean?
So, I mean, in public health, sometimes when people view public health, they think it's really just for the underserved, right? But public health is all of us, right? It's where you live, it's the type of environment, climate, it is the violence rates, it's your access to food, it is your behavior, right? So it's all those things that cross really your drivers of health. So, in the research for the book, Seal, and this was really, we're lifelong learners, but this was really kept hitting me in the face. Our drivers of health are 10% clinical, 20% social, 30% genetic, and 40% behavior. And behavior meaning our choices, right? So mental health is certainly big. That's in the clinical bucket. And so 10% clinical, 20% social, 30% genetic, 40% behavior. Over 80% of the money in America is spent on clinical. And so I'm not against clinical. I spent a lot of time in clinical. I watched it save people's lives. What I've also realized from my work in public health is that other things can save your life too. Access to fresh food, a supportive relationship, the ability to be able to understand with help how you change certain behaviors if you're genetically predispositioned, and you can try to slow some of that down. So there's lots of things that are not quite as flashy, or might not necessarily be the quick fix that we really need to serve up for people. And some of that's at the policy level, some of it's at the neighborhood level, and some of it is at the corporate level, and some of it's at our individual level. So that's why it's complicated. That's why it's hard to do. That's why it's not immediate gratification. And so that's why I'm really dedicating the rest of my life to trying to help do what I can do to make that a little bit more balanced for us.
And with that said, what is that when what does that mean exactly? Have you created a program? I know you're doing speaking engagements, and of course talking about your book, but what else is involved with that?
Sure. Yeah. So the book is really, it's hard to drive change if people don't feel like they're on, equal footing to have a conversation. It's daunting to have a conversation if you don't really understand. So I think first and foremost, we want people to understand that medicine is valuable, public health is valuable, but together, let's start having that conversation. So the book is kind of a level set, and the chapter contributors are awesome because they're doing it, right? So, it's one thing to talk about, it's another thing to do. So the chapter authors are actually living by example how by combining disciplines, we're able to make better outcomes. The second thing that came out is the fifth chapter in the book is called the Whole Person Index. So I'm a big believer in data. I am kind of a data dork, and I'm not really embarrassed by that. But, we don't measure some of the things, right? So clinical, we've got pretty good measurement. I would argue that we could do lots better even in the clinical realm. But in a lot of the public health realms, we don't have it measurable in a way that we actually show that the return on investment by investing in some of those things, like a domestic violence intervention, like fresh, locally sourced fresh food, like a behavior modification, not just the prescription drug without a behavior modification. Those things will pay dividends, right? So what we're trying to do is be able to have people understand. So the Whole Person Index is it's patent pending. It goes across all drivers. It gives you your gaps across all of those drivers so that you could get, say, if you're pre-diabetic, you can actually get fresh food and an exercise program with the same rigor as you get a doctor's visit in a drug.
Which is pretty awesome.
Yeah, I mean, we hope. I mean, it's people are like, that's it. I'm like, well, it's really not that complicated. But
I think we make things so much more complicated than they have to be.
correct. And, I'll give you a good example. And I do talk about this in the book. I was a geriatric pregnant person, right? So I didn't think I was going to be able to have a baby, got pregnant when I was 40, so we have a 10-year-old. So Gavin was born when I was 40. So high risk, I'm a type A personality, high risk for postpartum depression, right? I mean, we know the high percentage of women have it. It's not that my OB didn't want to ask me, but if the OB was like, Katie, do you think are you depressed? Or you have anxiety? If they didn't have a solution, right? Then they ask me, and then what are they going to do? Right. So that's part of it. We know that that stuff is there. We have to pair up the solution so that if I say, yes, I'm depressed and I'm anxious, that there is a support system there to be able to help me get the care that I need. And the pieces are there. They're just not tied together. And we know the stats, we know the things that are impacting us. We just have to tie it together.
I think that's so important. And I think that is, I think just having those pieces all together. And like you said, it is going back and looking at the whole person. Like,
Yep.
health isn't just exercise, health isn't just eating right, health isn't just, you know, going to, a mental health coach. It's all, you have to have all those pieces, and there has to be somewhat of a balance, really. So I think that is pretty amazing. And who can access that? Is this something that people can access now, or is it for an individual? Is it for a group? How does that work?
So I have a website. If you go to wholepersonindex.com, you can see the latest information. So where we are finding great traction, and sure, we could do it for an individual. I actually use myself for the individual because the whole person index will give you an individual report, will give you a population report, right? So if I'm an employee and part of 300 people, it'll give me blind, de-identified, give me the trends of the population. It'll also give me a community report based upon where I live and those factors that impact me. So that's one of the differentiators, is that it gives all three. And see, Laura, I'll tell you what's been really fun is that talking to people who ask lots of great questions about it, question the validity of it, or able to, I love that, right? I mean, we're not just, trying to just say, great, just do this. Let's not ask hard questions. But where we have gotten great feedback are individuals, but also employers, right? Because employers actually bear the brunt of most of the cost of healthcare. And if you go out on the market to buy a product on the benefits market, it's largely filled with clinical tools, right? So we're trying to change that. It's not that there's not enough money, but what are those tools in the toolkit? And then payers are very interested, as they're taking the risk on some of this. So it's been very fun to have the conversations and find people that are willing to question the status quo, but not just add. Right. So the other thing that I really am not a fan of is that people just add on top of everything. So what the whole person index does is actually identify what's not needed and be able to focus on the highest best use. And that's how we're going to make better health outcomes at a lower cost for America, not just adding on, right? There's plenty of people that want to add on, but how do we get
Yeah.
rid of what's not adding value? And
Well,
that's
I
hard.
think, well, it is hard. And I think that what you've stepped out to do, you are going to challenge quite a few people. And I think there'll be people that challenge you on it. But I think what you're doing is really important. And I think it is definitely a need. And I can definitely see, not just from the individual side, but definitely from the corporate setting. Like, that's huge, because that is corporate health. Like, you hear about that all the time. And they're trying to find ways for their employees to be healthier. And sometimes they focus too much on, the typical exercise and nutrition, which I'm a fan of, that, like, that's my
Oh
jam.
yeah.
But
Yeah.
there's so much more to it than that. So I think creating this is can definitely make a big impact.
And it changes during our life too, right? I mean, so different places that you're at, are you in your 20s, or have you just had a baby? Have you had health? Are you taking care of somebody? There's a lot of caregivers out there, and that puts a lot of stress and a lot of differences on the way that we experience health. So the other thing I like is that it's non-judgmental, right? I mean, like, so many times people are afraid to talk about things because of the judgment. What we're trying to do is set up, so like, let's just be honest about the things that are going on so that we can try to close the gap, so we can close and help each other out. So it's been tons of fun, and watching an employer actually offer locally sourced fresh food as part of their benefits program is pretty cool. And so it's happening, and it's awesome.
That is awesome. Like, that's so good to hear, because that's where they can make a really big impact,
Yeah.
is coming from that side of it. So where can they get your book? Where can they contact you? All of that.
Sure. If you go to wholepersonindex.com, the website will have everything. You can sign up to get my newsletter. There's a newsletter that comes out about every month. The book's available on Amazon. It's also available on Barnes and Noble, all the outlets online. And I'd be happy to have anybody's feedback. I love to talk to people. Again, this change only happens when we're doing it together, and nobody has all the answers. So, it's a journey together. So
Absolutely. I think that's, going back to what you said earlier, not just women coming together, but just people coming together. because
Yeah.
that's how we make a bigger difference.
Yeah.
Uh, so I want to kind of switch gears now because we've talked about like we've stayed in the really serious avenue, and I want to talk a little bit more about you. What is one thing for you? Do you do something every week that you would consider self-care that maybe people wouldn't know?
I mean, probably not, but I mean, I used to do walking meetings all the time. You and I are fans. We do that.
Yes.
Exercise has always just been, I used to run, but I mean, truth be told, I'm a total klutz. So I fell last year and knocked all the teeth out of the front of my mouth. So, and then I fell again this year. So I'm really running's out. So walking's in, but some kind of exercise. Um, and typically with somebody like I do, one of my good friends, I've been friends with since fourth grade. We walk a couple times a week together. So yeah, that's my
That's
therapy. That's my fun of choice.
I love that. It is therapy. Walking and talking is like great. Like
It
I've gotten so much just from our conversations when we go, and I've carried that into my life with other people too. So yeah, I love that. And I think that is self-care. Like it doesn't have to be wrapped around, meditation or, even being by yourself. Like talking with someone is that. I think that's so important. Do you
I
have do you personally have something as far as inspiration, or like do you have a quote that you're leaning into right now, a song, a podcast, a book? Is there something that you lean into for yourself?
So there's a couple things, and so one, I love music. I mean, to me, music, and my 10-year-old son loves music too. So he can hear a song and he knows the words. So like we have a lot of fun with that. But I knew you were going to ask me this question, so I actually do. There's a quote that I've actually relied on for most of my life, and I think it's very true. So it says, "Peace. It does not mean to be in a place where there's no noise, trouble, or hard work. It means to be in the midst of all those things and still be calm in your heart." So I'm a fan of that because it's not that things are always easy, right? But if you've got some calmness about who you're spending your time with and what you're doing, and why you're doing it, you can get through the hard times.
Yeah, it's so true. Because I think we think that peace has to be like you have to be in this separate zone. You have
Yeah.
to be on your
Sure.
yoga mat, and that's where
Yeah.
you're gonna get peace. And it's like,
Right.
no, I need to have peace in the middle of the storm, in the middle of the chaos, like
Totally.
being able to hold steady.
Yeah. And see, I'll share this with you. I could have said this in my professional, but I think it kind of overlaps. I've been out now for 2 years from the corporate world, and I had the opportunity through a couple guys that I'm working with at Ruckus Health to meet two incredible women who are the founders of a company called Love Evolve. And so their mission is to actually wrap every baby in love in America. So there's 3.5 million babies, with two real big reasons and two big outcomes. One, because a visual cue of love, right? So the swaddle was invented by a woman named Sunny Good, who took her artwork, and it's beautiful, and put it on a baby swaddle. So a visual cue of love actually helps people around you feel more comfortable talking about that, and creates a much different type of space and environment. And then with the swaddle, you also get access to an app that's called the Love Entourage, which allows you to get critical resources during the fourth trimester, which I think most people are probably not aware, but murder, suicide, and death in maternal in moms postpartum, right? So we talk all about getting up to the birth of the baby, but there is such tenuous times for the mom and for the infant after birth that there are limited resources. So I have been working with that company. Their name's Love Evolve, Sonny and Presley Good. Their mission is so pure. Their passion is incredible. And they're going to do it, and think about what a visual cue, everything we've talked about, there's lots of different ways to make an impact. And so I would say I'm getting a lot of joy out of that, working with great people, with big, big, big plans to make a big difference for people.
I love all of that. It really goes back to your heart. And bottom line is that you want people to live, better, healthier, happier lives. And that there's ways for the community to come together and do that through organizations like this, as well as what you're doing with the Whole Person Index and your book. And so I thank you so much for being willing to like open up and share about this and have this conversation. I know how much you mean to me as in my life as a mentor. Like for those of you who don't know, my son is a nurse in the ER here in Charlotte, and Katie was such an inspiration and connector and like helped guide. And you meet people for a reason and you think it's for one thing and it turns out to be for something else. So you have been multifaceted. You've impacted my life on multiple levels. And so I just really appreciate you and appreciate all that you're doing.
Well, see, I feel the same way about you. And so the day we met is the day that both of our lives got better. Thank goodness. So we're stuck together forever. And we've been with each other through, the things that are great and the celebrations and the things that are hard. And that's what, life is about. That's when you find good people, you make a difference together, but you also help each other through the hard times. So I love you very much. And I'm really honored to be here with you today. So thank you. And now I'm crying, which is
I
like,
know. I'm like, well, I have such love for you because like you really have been such an inspiration for me. Like I think I've always been community driven and I've always been focused on how to make, where I live, work and play better and the connection with women and being able to like because you can connect with a lot of people, but then there's people that you connect with on a level that's different and there's that same heart share. Like you share that same passion and so like have such mad appreciation. So this has been a beautiful conversation and I can't wait to drop it.
and we got lots of great work left to do together. So
Yes,
let's
we do.
yeah.
Well, thank you so much for being on with
Thank
me.
you.
Thank you so much for listening to the Be Amazing podcast. If you enjoyed this episode, please send it to someone who inspires you so they can feel amazing too. If you want to help us reach new listeners, please leave us a review on Apple Podcasts. Don't forget, you can find the video versions of our episodes on YouTube. Follow us on Instagram at the Be Amazing Podcast or DM me at Cel Smart. I'll see you in the next episode.